At 50, depression in seniors, signs and natural solutions. Depression is not a normal part of aging. And yet it is the most common psychiatric condition in older adults, affecting approximately 15 to 20% of adults over 65, and significantly more among those in care homes or living with chronic illness. It is also one of the most underdiagnosed and undertreated conditions in this age group. Symptoms are frequently attributed to other medical conditions, dismissed as a natural response to life circumstances, or simply accepted as what happens when you get old. This is a profound disservice. Depression in older adults causes genuine suffering, accelerates physical health decline, increases mortality, triples the risk of cardiovascular events, significantly impairs immune function, and is a major independent risk factor for dementia. It is also, in a large proportion of cases, highly responsive to treatment, both professional and natural. Today we're covering the signs, the causes specific to older adults, and the evidence-based natural approaches. Depression in older adults often presents differently than in younger people, and this is one of the main reasons it goes unrecognized. Rather than prominent sadness, which many older adults deny or minimize, depression in seniors more commonly presents as persistent fatigue and lack of energy, loss of interest in hobbies or activities that used to bring pleasure, withdrawal from social contact and family, increased irritability or agitation, difficulty concentrating and memory complaints, physical complaints such as persistent pain, headaches, or digestive problems without clear organic cause. Sleep disturbances, early morning waking is characteristic, appetite loss and weight loss, and a pervasive sense of hopelessness or that life has little meaning. Importantly, older adults are significantly less likely to volunteer emotional distress to doctors. They more commonly report physical symptoms. This means that persistent physical complaints, particularly fatigue, pain, or appetite loss, warrant consideration of underlying depression. Grief vs. depression. Grief following the death of a loved one is a natural process that can look similar to depression. The distinction lies in the persistence and pervasiveness of the symptoms, and in whether the person retains the capacity for moments of positive emotion and engagement. Complicated grief, lasting more than 12 months and severely impairing function, warrants professional assessment. Depression in older adults is rarely caused by a single factor. It typically emerges from the convergence of several life losses: loss of a spouse, siblings, close friends, professional identity after retirement, physical health and capacity and independence. The cumulative grief of aging creates genuine psychological burden, social isolation and loneliness. Among the most powerful drivers of depression at any age, and particularly common in older adults whose social networks have contracted: physical illness, chronic pain, cardiovascular disease, cancer, neurological conditions, and virtually every major chronic illness significantly increase depression risk through both biological and psychological mechanisms. Neurobiological changes. Aging alters serotonin, dopamine, and noradrenaline systems, the neurotransmitter pathways most directly involved in mood regulation. Medications. Many commonly prescribed medications list depression as a side effect: beta blockers, statins, corticosteroids, certain blood pressure medications, proton pump inhibitors, and others. Vitamin and nutritional deficiencies. Vitamin D, B12, folate, magnesium, and omega-3 deficiency all independently affect mood regulation. These are correctable and should be part of any evaluation. A range of natural interventions have genuine, well-evidenced antidepressant effects, some comparable to medication in mild to moderate depression. Exercise. Physical activity is one of the most potent natural antidepressants available. Aerobic exercise increases serotonin, dopamine, and noradrenaline, promotes neurogenesis in the hippocampus, which shrinks in depression, and reduces inflammatory markers that drive depressive symptoms. Multiple meta-analyses show that regular exercise reduces depression scores comparably to antidepressant medication in mild to moderate depression. The minimum effective dose: 30 minutes of moderate aerobic exercise, 3 to 5 days per week. Sunlight and light therapy. Sunlight suppresses melatonin, raises serotonin, and regulates circadian rhythms, all of which directly affect mood. A minimum of 20 minutes of natural outdoor light daily is a straightforward natural intervention. For seasonal or winter-exacerbated depression, A 10,000 lux light therapy lamp used for 20 to 30 minutes each morning is as effective as antidepressant medication for seasonal affective disorder. Social connection. Loneliness is both a cause and a consequence of depression. Rebuilding and maintaining social connection through clubs, volunteer work, faith communities, regular calls with family and friends is a direct treatment, not merely a nice addition. Omega-3 fatty acids. EPA in particular has consistent evidence across multiple clinical trials for antidepressant effects, including as an adjunct to standard medication. 1 to 2 grams of EPA daily is the dose with the strongest evidence. Vitamin D deficiency is significantly associated with depression in older adults. Supplementation to adequate levels produces mood improvements in those who are deficient. Mindfulness-based cognitive therapy has the strongest evidence base of any psychological intervention for preventing depression relapse. The guidelines of the UK National Health Service recommend it for recurrent depression. Regular mindfulness practice measurably reduces rumination, a key driver of depressive thinking patterns. Purpose and meaning. Viktor Frankl observed that meaning is the most fundamental psychological need. Older adults who maintain a clear sense of purpose through relationships, creative work, service, faith, or lifelong learning show significantly lower rates of depression and better health outcomes overall. Cultivating purpose is not passive. It requires identifying what matters and deliberately engaging with it. Sleep quality. Depression and sleep are bidirectionally related. Depression disrupts sleep, and poor sleep drives depression. Addressing sleep disorders. Maintaining a consistent sleep schedule and improving sleep hygiene often produces meaningful mood improvement. Natural interventions are powerful, but they are not always sufficient, and they are not a replacement for professional care when symptoms are severe. Seek professional evaluation promptly if depressive symptoms have persisted for more than 2 weeks, daily function is significantly impaired, there are thoughts of death or suicide, or symptoms include significant weight loss, psychosis, or are accompanied by a recent major loss or diagnosis. Effective treatments are available: psychotherapy, particularly cognitive behavioral therapy and interpersonal therapy, antidepressant medication, and combinations of both. The stigma around mental health treatment in older generations is real, but seeking help is an act of wisdom, not weakness. Depression is not the price of growing old. It is a condition with identifiable causes and effective treatments. The natural interventions, exercise, sunlight, connection, omega-3s, vitamin D, sleep, purpose, are powerful and available to almost everyone. If you recognize these signs in yourself or someone you love, please do not dismiss them as normal aging. Talk to a doctor. Reach out. Life in later years can be and should be genuinely good. See you in the next video.